Okay, thank you so much, everybody, for coming today to hear this conversation at FREOPP about homelessness. My name is Judge Glock. I'm the Director of Research and a Senior Fellow at the Manhattan Institute. And I'm the moderator today, which means I'm going to have to restrain my natural tendency to loquacity. But luckily, that'll be easier because we have three fantastic experts on homelessness here to talk about the issue. I've also been told just to introduce them by their names because their bios will be in the program. On the far right is Michael Tanner, who has written a fantastic report on homelessness for FREOPP that I highly recommend to all of you. And here, Roger Velasquez, and here, Representative Tyler Clancy of Utah. So I'll start the panel by asking about which was perhaps the most significant national policy conversation we've had about homelessness in a while, and that's the Grants Pass case. Arguably the very first time the issue of homelessness has ever come up before the Supreme Court, and the case ended with what was seen as a pretty resounding affirmation of the ability of the city of Grants Pass to enforce laws against street camping and street sleeping. I'd like to open it up for our experts here to say what they think about the case, whether it was rightly decided, and whether or not it will change anything about homelessness policy going forward.
Well, I think that actually this is a pretty good example of the proper role of courts, and particularly the Supreme Court. If you look at this strictly as a constitutional question or a question of law, the case was probably correctly decided, that states that localities do have the power to enforce these laws against outdoor camping and sleeping in public and some of the other rules that were out there. That does not necessarily mean it's good policy. And in many of the cases that simply rounding people up and tearing down their tents and throwing out their possessions and forcing them down the street is not necessarily going to solve the underlying problems of homelessness. In fact, one of the city councilors in Grants Pass, when asked, the purpose of the law, said it's simply to get people to move down to the next town. Well, that's great for Grants Pass, not so good for the next town, and certainly not so good for the homeless population. So I think we should differentiate as we go through this between what is necessarily legal and what is necessarily the policies we should be pursuing in dealing with people who are affected by homelessness.
Yeah, it's important to remember that the Grants Pass case was about whether or not homelessness was a status offense. And if you look at the different cases that were used in making that decision, what it came down to is the Grants Pass law creating a situation in which a person has a status that ultimately results them automatically violating a law. And so it was a good decision, solidly based in the case law, where consistently it's been found that, if there was a case, for example, if you're an alcoholic and you are driving while intoxicated and you are found guilty, I mean, that kind of thing is not, you're not exempt from that if you violate the law because of a condition that you have. So that was the substance of that case. It does absolutely nothing in terms of solving the problem, as Michael points out. Because ultimately what it allowed in this particular circuit was the pursuit of breaking up encampments, but it doesn't solve what do you do. And in Albuquerque, where I've been doing a lot of work, we're finding that which wasn't affected by the Grants Pass case at all because it was in a different circuit. There's just chasing a cat and mouse game of here comes an encampment, people call the local hotline, police come in, roust it, take away the tents and whatever, and then that pops up somewhere else. So it's good that the case is resolved, but it has very little effect on solving the problem one way or the other.
Great comments. I agree. The Grants Pass decision didn't solve the problem, but it certainly started a conversation that was prohibited from being had because of the Martin versus Boise case. You had states like Albuquerque or in Utah, Salt Lake City, who were judicially not impacted by the Martin versus Boise ruling, but their inability or unwillingness to push the issue because of the Martin versus Boise issue caused a blanket non-enforcement policy, which created severe public safety issues from those encampments. And that's really what I think reaffirmed when they talked about Robinson in the Grants Pass case, is that we're not talking about someone who is a status offense, but what comes when you fail or are legally barred from enforcing the law. We know that chaos thrives in anonymity, and that's really what the Martin versus Boise case created. I agree with Michael that much more is going to need to be done on mental health care, on just housing, I'm sure that you'll talk about. But certainly I think this was a great step in the right direction. And ultimately, it leaves cities, counties, and states with no one to point a finger at when we do say, you're not solving the problem.
Thank you. Yes, I and Manhattan Institute, as well as some other groups that I know are here, including Cicero, submitted some amicus briefs in favor of the ruling and the general policy represents. But like Odysseus lashing himself to the mast, I will restrain myself from commenting further, even though it takes every fiber of my self-control. But then move on to the next question, which is highly related to that first one, which is how much of homelessness is a housing problem? As I've often pointed out to people, seems somewhat intuitive in that the very definition of homelessness is the absence of a home. Therefore, there's a lot of people, of course, who think homelessness is mainly or almost entirely a housing problem. I think we all agree to some extent it is, but how much is it actually, and how essential is just getting housing right to the whole issue?
Well, I'm going to jump in because there's a book that came out called Homelessness is a Housing Problem. And it is most definitely, in the way we think of it, is not a housing problem. It is a problem of an intersection of economic issues, mental health issues, and chemical substance or abuse issues, addiction issues. And the one thing I will say is that for those of us in this room who might be having various mental health issues, which I'm sure we all do, some of us more than others, the difference between us and somebody who is below, at a very low level of income, is there's fewer guardrails to break through. So someone who has insurance, who has a job, who has a family, who has a house, if they're struggling with mental health issues, it's going to take a considerable length of time, and there's going to be protective factors kind of bouncing people back into a system of care. If somebody is at the lower end of the economic spectrum and they're struggling with various mental health issues, they have a criminal record, they have other things going on in their lives, that fall into getting involved with very, very serious drugs that are very damaging, and not being able to hold and keep and hold a job is going to lead to the kinds of things we see on the street. But it isn't a question of saying, well, if everyone had an apartment key, then suddenly the problem would be over. So I think it's an important distinction to draw in the discussion, because it's not about just building lots and lots and lots of apartments and handing out apartment keys, because most of those folks would not be able to sustain that even if we had and spent all that money.
Yeah, I have to largely agree with that. I think part of the problem here is we tend to think that there's some sort of sui generis homeless person that, and so we can come up with this sort of one-size-fits-all solution that's going to solve the problem for everybody. And it's not. People are homeless for a lot of different reasons. In some cases, it's mental illness, and we have to deal with the mental illness issues. In some cases, it's substance abuse, although we need to be a little bit careful because there's kind of a chicken and egg issue here. A lot of people who are on the street sort of self-medicate because, frankly, living on the street is not very pleasant, and they do things to relieve that, so they drink too much, or they end up getting addicted. So sometimes the addiction problem comes afterwards. Sometimes the mental health problem comes afterwards. And then there are people who simply drop the street because there isn't affordable housing. And I think that's a particular issue in some places like California, where housing costs are certainly through the roof, which is led by a lot of bad policy relating to zoning and things of that nature. I walked a lot of homeless camps in California a couple of years ago, talking to the folks there. And I met, for example, a school teacher, a state employee who worked actually in the housing department in California, an emergency room nurse, people who were living in their cars because it's impossible in San Francisco, for example, to find low-cost apartments. And if you do happen to find an apartment and then something happens in your family, you have an illness or you lose your job or something happens, you basically fall straight to the street because there's nothing as an intermediate prospect in there or an affordable prospect. So to some extent, bringing down the housing costs will help, but you're also going to have to deal with these other issues and have more mental health services available, more shelters available, more ways to deal with people who have other problems as well.
Definitely agree. We talk about homelessness as a monolith, but yet we can all, whatever side of the political spectrum you're on, we can delineate that a mother fleeing domestic violence with her 2 children is going to need a different policy intervention than someone who uses meth 3 to 4 times a day. Both need our help, both need our care and attention as a just society, but certainly they're going to need different interventions. I think the biggest thing is that we talk about this and we all shake our heads and nod our heads, but the federal government, hopefully not too much longer, has flatly disagreed with that sentiment. And they have required states to abide by housing first restrictions. This is the idea that, for example, someone who is experiencing deep mental health challenges, and then you compound the factors of using methamphetamine or fentanyl, the only thing that money can be spent on is getting that person in a single occupancy home. And the idea is that all those addictions will just melt away and they can stabilize after that. Ironically, if you talk to individuals living on the street, many of them have had housing several times over. But in a surprise to absolutely no one, if we don't solve those underlying issues, it's only going to compound and further those challenges. And so I agree that housing is certainly a piece of the puzzle, but I think it's more of a piece of the puzzle for a certain segment of our homelessness challenge as a whole. And I think it's flatly and self-evidently not true when we look at these massive homeless encampments and pick any city across the country and say, well, certainly if we had another apartment complex, that would be solved. We know that that's not true, but it's also, I think, we unfairly pit those against each other sometimes.
Thank you. And that's an almost too perfect segue to my next question. One of my favorite stats is that in the city of San Francisco, approximately 11% of the entire homeless population, their last known address was a subsidized housing unit. So they were actually put inside, and because of their inner demons, they could not maintain themselves in that housing unit. So the question of housing first has been perhaps the most contentious outside of the enforcement issue in the entire homelessness space for some years now. As Representative Clancy mentioned, this is a federal policy. I'd like to hear any of the other panelists, including Clancy again, if you'd like to chime in a little bit more about that, about housing first and what they think the direction this will be in the next administration and what the future of this policy may bring.
Well, my simple answer for that is that I hope the next administration can block grant HUD funding, or at least give states the opportunity for a waiver to innovate with the money that is coming earmarked for homeless services. A state like Utah, where I live, is going to have different challenges than Massachusetts. Allow us the flexibility to innovate and work on those localized issues.
So it's important to note that the way that we build subsidized housing is primarily through the low-income housing tax credit program. And in a place like Seattle right now, a unit of LIHTC apartment housing is like $600,000 a unit. In Albuquerque, it's like $350,000 a unit. A single family home costs $315,000. In California, the cost has reached $1 million. So we don't know how to produce this housing in an efficient way. And the problem is that when we talk about building our way out of that problem, the way we're set up to do it, it would be impossible. It would cost billions and trillions of dollars. And again, as you point out, simply handing somebody an apartment key is not going to solve all those underlying issues. So it would be a waste of money. What we've seen, close up, and like Michael, I've been working with groups that work with the homeless community. We have in Albuquerque a street called Zuni. On one side, there's a 30-unit tiny house project, 120 square feet. It cost $5 million and took about 5 years to build, and it cost $1 million to operate.
Do you know how big that is? Just out of curiosity, how many units or roundabouts the size of this? You said it cost
30 units, 120 square feet per unit, no plumbing, central bathrooms. And across the street from that, a guy named Jesse Harden, who runs a small church there, tried to build like 5 tough sheds, and he was actually moving people off the street into these little sheds, and there was a central bathroom, central kitchen facility, and washing, washer and dryer. And those folks were living in those units, and the city came in, red tagged it, shut it down because it violated the building code. And then they came back, and after about 6 or 8 weeks of trying to get a permit through what's called safe outdoor spaces, he can now put tents next to those sheds legally, like 5 tents, because that doesn't violate the building code. So we went from a situation where now it's illegal to sleep on the street, and you can shoot people around and chase them around or jail them and pay thousands of dollars to keep them in jail. You can put them in the emergency room. You're gonna pay for it. Or you can allow Jesse to put people in improvised shelter on his private land and get them moved off. But we need legislatures to preempt local law and say it needs to be safe and it needs to be healthy, but it doesn't have to meet all the zoning and requirements. If this is truly an emergency and we want to move people off the street, you're either going to put them in jail and your taxpayers are going to pay for it, or you can have churches or other groups like Jesse build this sort of improvised shelter that can meet the baseline standard of the Residential and International Building Code and very, very cheaply do it on private property. So that's where we got to start. And then those people can move into recovery where they're capable of recovering and they've got a foothold. But it's not a LIHTC apartment or sleeping in the street or a 120 square foot unit that costs $5 million to build. So we need to come up with things that are more, and the building code is really a huge problem with those sorts of solutions.
Yeah, I just have to agree with that. It's also not just the cost, and the cost is truly outrageous. Huntsville, Alabama, they're building departments for Housing First are going to cost $400,000 each. When you think about it, could cost what they could provide in terms of mental health services or shelter beds or things like that for the same cost. It's also the time. There was a referendum passed, I believe, in Los Angeles several years ago to create a fund that was going to provide for housing for the homeless. I don't think they've actually built a house yet or an apartment yet under this, and this was about 7 or 8 years ago that it passed. So. Again, building codes, California Environmental Quality Act, zoning laws. I mean, just one thing after another that get in the way of actually producing any of these things that we need to be looking at.
Yeah, and I'd like to second Representative Clancy's mention of the block grants. Conservatives used to be all into block grants. You heard about them all the time, and now people don't get excited about them. They always want new little ideas to attach to these things. I was talking to a guy in the Department of Transportation in one of these states, and he's like, my constituents give tax money up to D.C. It gets laundered through there. They take about 10% off the top, and they give it back to us with a bunch of weird conditions attached to it. Why don't we just cut out the middleman for a lot of that stuff, I say. So there seems obviously some consensus that the contemporary housing first model is not sufficient, and it's not necessarily effective, and it's certainly not a universal solution here. So we've heard a little bit about what some other solutions be. What do you guys think some other potential things the state and local governments can do to solve this rather than the federal government?
I would say an easy one is to begin measuring success, begin measuring outcomes effectively. If we took the remaining 25 minutes to describe the bureaucracy that's involved with our current homelessness system, none of us would leave feeling confident that our homeless brothers and sisters are being effectively served on the services level. So we really need to look at governance, I believe, start measuring outcomes. And also what we did in Utah last year with the help of some partners here was to begin to go above and beyond what HUD requires us measure and do some state level measurements about delineating subpopulations within homelessness, delineating different types of service providers, the idea that there is a difference between a low barrier shelter, a domestic violence shelter, and maybe one of these therapeutic communities that are looking to really help people recover from long standing challenges, beginning to measure things effectively, choose programs and choose our funding that's tied to outcomes, not incomes. We can all agree that serving people and giving out more blankets, socks, and pillows is a good thing, a morally good thing to do. But certainly it's not going to solve the issue. If it was a one-time appropriation, if it was a funding thing, if it was simply a resources, it would have been solved already. Someone would have had the heart to do it. It's more complex than that, and our system demands more structure than that.
And we always talk about markets, and people living on the street are they're looking at the marginal rate of substitution. I mean, part of the thing is if you think about going into a homeless shelter, often they're dangerous, they're unhealthy places. You have to get there at a certain hour. You get to stay there overnight, and then you have to pack up all your stuff and go out back outside again. And there's a whole bunch of reasons why an encampment is preferable in terms of looking at your different trade-offs. And that's why a lot of the folks end up, just deciding I'm going to take my chances with several other folks and stay in a camp. So creating low barrier options is an initial sort of opening. And one solution that might create some competition in the market is to use what I call value capture, which is to do, to do some bonds that would borrow some money to begin to address some key issues with best practice. And then, and part of it, you have to identify what the impact of this is on law enforcement, emergency room use, kind of identify how much that is costing the community and the city and the jurisdiction, and then say, okay, let's go and implement some interventions that we think are going to solve those problems. And as you begin to lower those costs, use the savings to cover the debt service on those bonds. And that could create some opportunities if regulations were pared back so that agencies, local government departments could say, all right, I know we could solve this, but we've just been inhibited by the rules and the bureaucracy. Let's go after it. We know that if we can put a dent in the costs, fewer arrests, fewer police calls, fewer emergency room visits, that's going to save us enough money that we can put that money into the debt service, and then we get to keep the savings afterwards.
This is why I hate the federal bureaucracy on this with the fire of 1,000 suns. Anyway.
Let me suggest three things that I think could be done that would help. One is we need to go back and revisit the idea of institutionalization in the case of mental illness. Now, we need to be careful of this. There was a reason for deinstitutionalization. Let me try to say that again. Deinstitutionalization. Those mental health facilities were horror stories. People naked, covered in feces, living in the hallways, never seeing an actual treatment specialist or anything like that, just kind of warehoused under the most inhuman conditions. That's one of the things that drove this. And there was also a great deal of abuse that went on in terms of who could get locked up. LGBTQ youth, for example, or women whose husbands didn't feel that they were sufficiently submissive and so on, things like that happened throughout history. Other countries have locked up dissidents for political reasons and so on. You don't want someone locking someone up because they voted for Harris or Trump or whatever, and they say, oh, they must be crazy. We don't want that sort of thing. So you need to have some sort of protection. California recently launched a special court system in which which for conservatorship, which people could be put into conservatorship, but they were guaranteed a public defender to represent their interests along the way. There's a special court that could handle things like this. I think that's a good approach, and that would necessary that people would be put back into institutions to be treated. Second, I think we need to do more investment in terms of mental health facilities and shelter beds that are available. There's only about shelter beds to handle about 50% of the homeless population across the United States. And they're not always a match. In many cases, they're in places where there's not a great deal of homeless population, and then in places where there's a lot of people experiencing homelessness, there's no beds available. In California, less than 50% of the people could be housed on any given night if they actually tried to do that. And third is I think we need to deal with the housing issues so that we have more low-cost housing available. And that means dealing with zoning laws and building codes and lot sizes and parking requirements and things of that nature that simply drive up the cost of apartments. If the cheapest apartment in your neighborhood for a one-bedroom apartment is $3,000 a month, as it is in some places in California, you've got a real problem there, and that's when people are going to fall to the street. So you're going to have to deal with housing, you're going to have to deal with mental illness, and you're going to have to deal with temporary shelters.
That's another almost too perfect segue, or one could say even preempting my future questions I was going to get to about mental health and drug abuse. So I would note that when I describe these issues to some people, they correctly say the large majority of homeless people do not have a mental illness and do not have a drug abuse problem. But as the panelists have already discussed, this is because we're talking about very distinct populations, the people in shelters, single mothers with children, etc., versus those people out in the street that most Americans think of as homeless. When I was with a homeless outreach worker in San Antonio, I asked him how many of the people he encountered on the streets had a mental illness or drug abuse problem. And he said, well, conservatively, about 100%. That's a pretty typical response for people out on the street for long periods of time. That's a different population and need have different requirements from those in the shelters. So Michael's obviously already teed us up with some important issues, how to deal with mental illness. How do we think we have to deal with these crucial issues of drug abuse and mental illness, especially for the unsheltered?
Well, you can't have it both ways. You hear people, oh, Reagan let everybody out of the institutions, and that's why we have the problem. It's horrible. And then you come back and say, well, there has to be some intervention. If you found yourself in a situation where you were not able to make lucid or coherent decisions, and you were out in the street half naked, you'd kind of think, well, I would hope somebody would intervene and take me somewhere and do something with me. We've decided as a matter of policy that we're not going to do that. As Michael said, though, we run it's going to be expensive, and we're going to have a situation where a judge is going to make a decision, and there may be a person who falls on the wrong side of that. There will be inappropriate institutionalizations, and we will read about it 20 years later, and there'll be, primetime television shows about I was locked up it's going to happen. But the question is again, the marginal rates of disutility, and trying to understand, well, we've got people suffering in the street right now. And I had a woman that I worked with that she did not know where her son was. And they found him naked in San Francisco running around in traffic, and they arrested him and detained him, and he was institutionalized, and they were reunited that way. And she said that's the only way he is alive today, because there was that intervention. And so, but it is a challenging thing because it's expensive, again, and it's also fraught with, there's going to be those false positives or whatever, where you're going to find people that fall on the wrong side of the line for the wrong reason. And so we're going to have to again, come up, like you said, come up with some good measurements and try to figure out how to address that. But we've got to do a combination of low barrier, managing the suffering to some degree, and that means harm reduction. It means some things that we may not like. Some encampments that are permitted, so people can have that kind of solution on private property or on public land that is supported, and then have a continuum of housing where people can move along that continuum towards different places where they can find something that works for them. But it is not a one-size-fits-all.
Well, I think Michael really teed it up perfectly, and whoever can answer the following problem will make the most impact on this issue. We have one side of the issue that looks at, when we talk about addiction and mental health crisis, we say we cannot hold these people accountable in the criminal justice system because they are dealing with something that's outside of their control. They are driven to break into your vehicle and steal your stuff because they're addicted to meth. And for that reason, we cannot prosecute that person. They cannot be intervened with in the criminal justice system. Fill in the blank for any other mental health or addiction challenge. Now, on the same side, you'll have very reasonable people on all sides of the aisle say, well, shouldn't we mandate that person get mental health care? Or shouldn't we mandate that person to get drug treatment? And the ACLU will sue your state or your city if you attempt to do so. So we're at this nexus where we say, on one hand, these individuals have no accountability, and they don't have an ability they don't have agency, they don't have an ability to make decisions that are rational. And on the other hand, we say, well, we can't force these people to get help. And so I think that is the situation that we're currently in. That situation is untenable and extremely unpopular. You've seen Proposition 36 that just passed by a dramatic margin in California to bring back some of these penalties for what were considered low-level drug offenses. Now, talking on the mental health piece, last year I sponsored legislation. It was called HB 299 in Utah. I know you were all on the edge of your seat trying to figure out what that was. And we building on Michael's work, we looked at conservatorship and civil commitment in Utah. And we wanted to change the definition for civil commitment to say, because of a severe and persistent mental illness, you're unable to meet your basic human needs, which jeopardizes your life. That was the definition that we wanted to put in place. The Department of Health and Human Services said, well, that you'd be catching such a large net, it would be almost 100% of our individuals in the point in time count for unsheltered. And that was why they say we couldn't do it. So we're kind of at an impasse of what we self-evidently can see that we need. We need more addiction recovery centers. We need more treatment. We need to be able to meet people when they're ready to get help. We need to have the infrastructure to do so. And I also think too, we need to claw back some common sense reform in this area. The last thing I'll say on the harm reduction issue, because I don't think in the year 2024, we can talk about homelessness without also mentioning harm reduction. When you go to a lot of homeless encampments, the only outreach, the only help, and I put that in quotations, that you'll see are people giving out syringes, people giving out crack pipes, people giving out straws and tinfoil. And we've gone a long way from addressing the AIDS crisis in the 70s to giving teenagers who are struggling, teenagers who have run away from home, teenagers who are, and I say teenagers, 19, 20, 21-year-old kids really, who are destroying their life, and our intervention is to help them on the way. And we're patting ourselves on the back by giving individuals who are addicted to fentanyl, which will eventually kill them, we're giving them needles in the namesake of stopping hepatitis C. So at some point, we have to revisit our harm reduction measures to make sure that we're pushing people into treatment, into healing. And I would say this is what I believe, and I'll be quiet after this. I believe this really needs to be our mission statement for those of us who care about our brothers and sisters who are suffering on the street, is we will meet you where you are, but we love you way too much to let you stay there. So
I think it's important. I think we're probably going to have to blow up the category harm reduction, because what you're talking about, there are reasons why those things are done. Part of it has to do with the nature of overdose risk with some of the methodologies of ingesting this stuff. So I thought when you said that, I mean, when I first saw these things that are being done, like in places like Seattle, I thought, what in the hell are they doing? But I can understand some of the public health the health reasons why they're doing it in terms of overdose and the risk. But that's, it gets a bad name from some of those things, and I think we need to change the category. When I look at an encampment, we had one that formed in Albuquerque that was on private property, and it was about 35 people that were setting up tents and improvised shelter, and it's illegal, so it had to get cleared. But I looked at it from a standpoint of spontaneous order, that you had people suddenly solving a problem, using innovation and saying, hey, and they formed their own sort of local government, and they had a mayor, and they were kind of running things, trying to keep order in that camp. It's not something people are going to like to see. It's very hard for a government or elected official to come out and say, hey, this looks great, a shanty town. But the point is that there was we were able to, observe people going in and getting case managed. And, out of those people, about, half a dozen of them wound up getting into treatment and getting into a better situation. So, that category of harm reduction, I know, brings in a lot of baggage, but I think the idea of, there's a guy named that wrote a book called Hungry Ghosts, who worked in Vancouver with populations. Not everybody's going to recover completely. There's going to be people who are going to stay just on the verge of, in some form of addiction. And we're either going to say, well, you have to quit completely, or you're not going to get, in other words, there's going to have to be some place where we're going to have to manage that suffering. And that's a difficult task to try and measure that and come up with measures but we have to start somewhere.
Yeah, I just want to jump in real quick on this and say we should recognize as well the limits of law enforcement in dealing with this. Putting somebody in jail for a few weeks is not going to cure their addiction or get them off of something. And in many cases, when we deal with these homeless camps and stuff, we come in, it's throw away their tent. Let's make sure, they lose their identification. They lose any medications they had. The women are left without the guy who was protecting them, so they're often they're assaulted and things of that nature. You've got to be a little bit careful of simply saying we just come in with with a bulldozer and police and solve these problems. The police are a blunt instrument and not capable in many cases of these sort of more subtle requirements.
I would just note that, like Representative Clancy, I think I've also talked to some people that the only time their loved ones got better, or they at least knew where they were, was after they were picked up by the police. But it's definitely a balance that has to be struck when you're looking at how to deal with people in a mental crisis or in drug addiction. I would also note that, like Roger, something that what I call the stealth radicalization of the harm reduction movement. I wrote a piece recently. If you guys walk up to 7th Street here in D.C., within sight of a children's playground, there's a vending machine dispensing syringes, pipes, and what they call booty bumping kits. I, with a few buttons, typed in and got my own safer rectal drug administration kit. This is it's a nice conversation piece in the heist now. I pull it out when dinner parties get a little slow. Everyone has questions about it. But this is obviously it actually was funded by the federal government. This is a very far way from we're exchanging a dirty needle for a clean needle for someone getting Hep C. This is giving out free booty bumping kits and vending machines funded by taxpayers. And most people are not aware this is where the conversation is at now, not over here. But with that, I would love to open up for questions. We have 7.5 minutes left. So right there.
Yeah, to what extent is the problem exacerbated?
I'm sorry, we'll get you the...
I've never needed a mic. To what extent is the problem exacerbated or indeed perhaps unsolvable because there's no coordinating authority? In other words, there are all these silos: emergency rooms, police, mental health workers, courts, building code officials, all that kind of stuff. And so there's nobody to say, to solve homelessness, this is the coordinating authority.
I do think that that's part of it. I think there's gaps in the system where, someone, we hear it again and again, is that someone manages to get themselves sort of a foothold in some part of the system, and then they go to be handed off to the next step of the way, and there's nothing there. Either like vouchers, the hotel voucher thing, where, okay, you get a six week hotel voucher and then it runs out, and they're just like, well, too bad. So the folks are just constantly struggling with that system, and I get the idea of accountability, but again, if someone is really trying to dig themselves out of that, and they get a certain part of certain way down that road, and then it's just a dead end. And we're not using the housing management information management system effectively and sort of coordinating. Some of it has to do with ACLU things about tracking people. Like they fight the idea of saying, okay, Bob or Mary we're sort of following them through the system so we can kind of know and aggressively case manage those people that are a smaller number of people. All of those things I think matter.
And if okay, we keep moving on quickly so we can get some questions, and we only have 5 minutes left.
I was just going to be real quick. We don't even know how many people are homeless. I mean, they do this point in time count where one day in January, usually it is, they send a bunch of people out to count the number of people under bridges and what have you, and then they come up with an estimate based on that. But we don't have good data on so much of this.
And if you ever have the chance, I highly recommend everyone can sign up for it and participate in this point in time count in January in any major city in America. I highly recommend it.
Thank you. Representative Perucci from Utah. Obviously, Tyler Clancy is our rock star. I guess as a policymaker, when I hear this discussion, there's a little bit of frustration because we believe in fairness and consistency under the law. And I've done ride-alongs with Highway Patrol where all night we're pulling people over for their taillights being out. And there was a group of individuals who were homeless lighting a fire in the middle of downtown and literally blocking traffic. And I said, are we going to pull over? And they're like, oh no, we can't do anything. And I was like, what? But we're ticketing people all night long for having a taillight out. Which one is a bigger potential harm to the public, right? So I guess, and I think taxpayers are tired of the inequitable treatment. I really do. And I think that's where you're seeing a massive push on, there's got to be some accountability. There's got to be some enforcement. in Utah, if you are homeless for the reasons outlined, like domestic violence, or you lose your home or a medical bill comes, we have a program. There are so many social safety nets. I feel like chronic homelessness is what we're hitting at, like the group we just can't crack that net. At what point do you say, we've blown $300,000 on you? We are going to have to say you cannot camp on the street. We've got to shift you somewhere else. Like, to me, I think taxpayers are not willing to tolerate this much longer. And I know that I sound like a hard A, but like that's the sentiment.
No, that's fine. We can do that. We can do that. But if we spend $300,000 already in this individual, then the honest answer is you're going to pay to keep them incarcerated. Okay, so that's going to cost you $50,000, $60,000 a year to keep that person. Well, I know it isn't, but I don't like the elected officials. You know, the mayor, you know, the mayors of these towns are hearing this all the time. What you're saying, so they're responding. But if you grab the folks and you say, okay, that's enough, we're holding you accountable, and you're going to do 90 days, you're paying for that 90 days. And at the end of that period, they're back on the street. So it's a false solution. I get the frustration, but it's not going to work.
So for clarification, Senator Shamp from Arizona, I'm a perioperative nurse. And for anyone that has seen a schizophrenic woman come into the operating room where you can no longer tell her anus from her vagina because she's been assaulted so tremendously, gang raped in an encampment, you have a little bit of a different view of it. And so when we talk about it's going to cost money, to me, the right and just thing to do is to make sure that never happens to that woman. So if it's going to cost the citizens money, it's actually going to cost. Preventative medicine is always less expensive. And so what I'd like to know is, what as policymakers, how are you advising policymakers as far as preventing this from even happening? We know that people that get addicted to drugs, less than 5% maintain any kind of long-term sobriety ever. That's been a statistic for a very long time, whether we're talking about alcoholism or fentanyl. But when we're talking about the prevention, it's a whole continuum of care of these people that we talk about. So the social services, I agree, we have the economics, we have those safety nets built into our system. Do they need tweaked? Yeah, because they need to be separated out. But the situation of not making a decision to take someone out of a situation because it could cost money, I think is the absolute wrong way to look at it, because we need to be looking at it from a preventative level of actually saving these people and helping them.
I would just point out there are some examples. I was participating as the expert witness in the case against the city of Phoenix and the Zone, which was a 1,000-person strong homeless camp, and they managed to clear that whole camp with almost universal take-up of alternative services, minimal arrests except for those who were actively assaulting police officers, and obviously has improved the situation downtown immensely. Any last thoughts there on the enforcement and other questions?
All I was going to say is that I think what you described, we need to be able to have someone flow into the system, identify what their key challenges are, move them to the system, the piece of the system that we know will serve that need, and be able to move them through and measure that effectively. Right now, it's a crapshoot.
Yeah, I'm just going to tell you can't do prevention on the cheap. And that means that localities are going to have to invest in mental health services and drug abuse counseling, in dealing with, they're going to have to deal with things that stabilize rent prices, dealing with zoning and single family only housing and parking rules and all those sorts of things that get in the way of low cost apartments. You're going to have to take some steps up front, or you're going to have that spent that $300,000 and then still face the problem of what do we do with those people.
And that's actually the end of our time. Thank you so much. Please thank them.